Wonderful. Good afternoon. I'd like to call this meeting of the Committee on Health to order. Today is Monday, December 9th, 2024. The time is 2:08 p.m. This is an additional meeting of the Committee on Health, and we are holding this meeting in a hybrid format, although all members are here present and accounted for in room 120 of the John A. Wilson Building. I'm at-large Councilmember Christina Henderson, Chair of the committee, and we have been joined by Councilmember Brianne Nadeau from Ward 1, Councilmember Zachary Parker from Ward 5, Councilmember Charles Allen from Ward 6. Today, we will consider and vote on 4 confirmation resolutions to the statewide Health Coordinating Council, as well as the Committee on Health's Council Period 25 Activity Report. Finally reached that time. Let's start with our nominations. So the Statewide Health Coordinating Council, also known as the SHIC, I did not come up with that, but that's where we are, advises the State Health Planning and Development Agency, or SHPDA, within DC Health. The SHIC assists SHPDA in the development of the district's health systems plan, which guides the district's priorities regarding healthcare infrastructure. The SHIC also makes recommendations on applications for certificates of need, which are required for any new healthcare service or substantial changes to a healthcare service in the district. The SHIC is composed of 15 members who represent various healthcare facilities, consumers, physicians, nurses, and the insurance industry. If there are no objections, I'm going to move 3 public members, nominees of the SHIC in block, and then we will take up the 4th nomination on its own. PR 25-1049 nominates Sheila Holt as a public member of the SHIC for a term to end February 11th, 2027. Ms. Holt is a licensed marriage and family therapist, a social worker, and a counselor with over 40 years of experience in professional counseling. She currently provides counseling through her private practice, which she has operated for 13 years. Ms. Holt was formerly the chair of the Board of Marriage and Family Therapy, which, as you will recall, we sunset in the Health Occupations Revision General Amendment Act of 2024. Ms. Holt has served as a clinical instructor at the University of the District of Columbia, as well as Trinity University and on the DC State Board of Education, where she helped coordinate the school-based mental health pilot program. She holds a master's in counseling from the University of the District of Columbia, and she's a Ward 5 resident. PR 25-1051 nominates Judy Brinkenhoff as a public member of the SHIC for a term to end February 11th, 2026. Ms. Brinkerhoff serves as an immunization compliance nurse at St. Columbia's Nursery School. Previously, she served as a school nurse at Beauvoir, the National Cathedral Elementary School, and the Washington School for Girls through the Ignatian Volunteer Corps. Ms. Brinkenhoff has served as a consultant at the Armed Forces Research Institute within the Department of Defense, and as an active duty captain in the Nurse Corps for the United States Navy. Ms. Brinkenhoff holds a Master's of Science degree in nursing from the University of Texas at San Antonio, and she is a Ward 3 resident. PR 25-1052 nominates Dr. Denise St. Jean to the SHIC as a consumer member of healthcare services for a term ending February 11th, 2027. Dr. St. Jean is an epidemiologist by training and currently a consultant at Boston Consulting Group, where she researches healthcare and the social impact. She is also a Robert Wood Johnson Foundation Health Policy Research Fellow focused on vaccine preventable diseases, population health, and clinical trial design and management. Dr. St. Jean holds a doctorate in epidemiology from the University of North Carolina at Chapel Hill and is a Ward 6 resident. I'll now open the floor to discussion on these 3 nominations. Hearing none, I move the draft reports and prints for PR 25-1049, PR 25-1051, and PR 25-1052 in block with leave for staff to make any technical changes. All in favor, please say aye. Aye. Great. Let the record reflect that the ayes have it, and those measures pass unanimously. Now to our final nomination. PR 25-1050 nominates Ruth Fisher Pollard to the SHIC as a representative of an incorporated association of healthcare facilities in the district. She is replacing Jacqueline Bowens from the DC Hospital Association with a term to end February 11th, 2026. Ms. Pollard is the president and chief executive officer of the DC Primary Care Association, where she works to enhance primary healthcare services in the district. She's also the executive director of the DC Connected Care Network, a network of DC PCA and federally qualified health centers working to increase quality and decrease costs for care. Ms. Pollard also has deep experience and understanding of the district's hospital systems. She's previously served as the executive director of the Advocacy and Government Affairs at Children's National Hospital and as the vice president and chief strategy officer for the Providence Health System, Ascension. Ms. Pollard has a master's in business administration and a master's of science and health administration from the University of Maryland Global Campus, and she is a Maryland resident. I'll now open up the floor for discussion on this nomination.
Chair.
Mr. Parker?
Thank you. I just wanted to share publicly, I gave a heads up to Chairperson Henderson that I won't be supporting this nomination, not because of qualifications, not because of a lack of background or an ability to do the job, frankly, but merely based on a principle that I've tended to try to vote for folk who are district residents to these district boards. I understand that the nomination is still very likely to move forward, and I support that, but wanted to emphasize that this is in no way based on qualifications or a lack of trust and the ability to do the job. Thank you.
Thank you. Okay. I just want to underscore again that this is a seat for a representative of an incorporated association of healthcare facilities in the district. So we don't have a lot of nominee candidates who are available because we only have but so many associations for healthcare facilities. But moving on, I now move the draft report in print of PR 25-1050 with leave for staff to make any technical changes. All in favor, please say aye. Aye. All opposed?
No.
All right, let the record reflect that the ayes have it. And for staff, please record Councilmember Parker as having voted no. Okay, we will now turn our attention to consider the Committee on Health Council Period 25 Activity Report. Council Rule 227 requires each committee to file an activity report before the end of the council period that details the committee's oversight and legislative activities during that council period. I'm incredibly proud of what this committee has been able to accomplish. Our collective work reflects a responsiveness to residents we serve, firm grounding in evidence and research, and a clear focus on improving healthcare outcomes and addressing health disparities for district residents. In total, over the past 2 years, the committee has held 55 hearings and roundtables. We have approved 18 bills and 110 nominations, as well as moved 21 budget support act subtitles across 2 budget reports. Those numbers provide a broad sense of how seriously we took this work, but I think it's important to also highlight the specific topics that we prioritized. First, enhancing behavioral health and substance use treatment. This committee allocated critical funding in both budget cycles for targeted behavioral health and substance use outreach at high need locations in, I think, all of your wards 1, 5, 6, 7, and 8. We also restored funding when the mayor proposed cuts to the Office of the Chief Medical Examiner's illicit drug surveillance program and the mental health program, mental health urgent care clinic at DC Superior Court. We approved several pieces of legislation in this realm. Bill 25-692, the Enhancing Mental Health Crisis Support Amendment Act, which strengthens the district's involuntary hospitalization program procedures. We conducted vigorous year-round oversight on behavioral health. We had roundtables on inpatient psychiatric facilities, youth behavioral health and public safety, as well as the opioid and fentanyl crisis. And we have started to see promising results in our reductions in opioid overdoses in the district. But this is not the time to take our foot off the gas of these critical programs, and we will continue to focus on this in Council Period 26. We also focused on improving health for birthing parents and families. The committee made significant progress in expanding access to reproductive, prenatal, and postpartum health during the last 2 years. This included several pieces of legislation, Bill 25-34, expanding access to fertility treatment, which requires health insurers to provide coverage for diagnosis and treatment for infertility. I am proud that this bill is fully in effect as of January 1, 2025. And it's a good time to mention that today is the last day for open enrollment. So if you wanted to make a change, we are winding down. We also approved and funded Bill 25-321, Home Visiting Services Reimbursement Amendment Act of 2023. Thank you, Councilmember Nadeau. It requires Medicaid reimbursement for prenatal, postpartum, and early childhood support. Although the executive has indicated they do not plan on implementing a fully funded law, we'll get to that with them. The committee will certainly continue to push for implementation in the next council period. We also made significant budget investments in maternal health, including the DC Diaper Bank for stillborn prevention, for childcare for pregnant and birthing parents who need medical care. And we've got some more work to do. In the area of increasing access to healthy food is directly related to healthcare outcomes for district residents. To that end, we made investments in both budget cycles, including restoring the mayor's proposed cuts to the healthy food access grants, including Joyful Markets, Healthy Corners, home delivered meals, Produce Plus. We expanded Produce Plus, which is a popular farmers market and incentive program, which previously had a 4,000 person wait list. In the FY25 budget, we moved a subtitle, the grocery access pilot program, to provide 1,000 low-income district residents with free grocery delivery. That's in effect now. And as we hear threats on the national level to cut nutrition benefits, the committee will continue to work to expand healthy food access here in the district in the next council period. We focused a lot on strengthening the healthcare workforce. Following the COVID-19 pandemic, many health professionals experienced burnout and left the profession. This left significant shortages in our health system. The committee took several steps to fill the vacancies on licensing boards, including moving 76 nominations, as well as improving Bill 25-321, Health Professional Licensing Boards Residency Requirement Act of 2023, which expanded the pool of qualified health professionals who can serve on these boards. We approved Bill 25-565, the Certified Nurse Aid Amendment Act of 2024, which merges the CNA and home healthcare licenses and increases the minimum wage for all direct support workers. Finally, we moved the most significant modernization of health professional scope of practice since 2006 through the Health Occupation Revision Amendment Act to make some much needed updates there. On enhancing patient care and health outcomes, access to quality health insurance was a priority for this committee. We have pushed the executive to improve the Medicaid and public benefit application process. We held 4 oversight roundtables on this topic in particular, 2 on Medicaid redetermination and 2 on the DC Access System, which processes Medicaid as well as other public benefit applications. We have started to see timeliness in these application processing improve, but we got more work to do in Council Period 26 to strengthen our public safety, our public benefit social safety net. We also reduced patients' costs for their prescriptions and medical care by passing legislation for the copay accumulator to prohibit health insurers from limiting manufacturer copay assistance, and which is very big in the conversation now. But we did prior authorization reform here in the district, which now limits how health insurers can use prior authorization to limit patient care. On students and youth, we did the Access to Emergency Medications Amendment Act of 2023, which requires schools to have staff trained to administer emergency medications. We did the Minor Access to Medical Records, which ensures confidential care for minors in certain circumstances. We made significant investments to restore some cuts to the school-based health program and ensure we have proper and appropriate staffing in schools. This isn't mentioned here, but Councilmember Allen is here. We did legislation around seizures and seizure medication as well. And finally, the closure of United Medical Center and the opening of Cedar Hill. We are dedicated to ensuring that the district's $400 million investment in the new Cedar Hill Regional Medical Center results in high quality care for residents in Ward 7 and 8 and the entire district community. The committee has also closely monitored the planned closure of United Medical Center. Our last roundtable of this council period will focus on this very topic. This Thursday, the committee we've got invited guests, leadership from both hospitals as well as the Department of Healthcare Finance to talk about patient transition, service wind downs, and Cedar Hill's readiness to begin operations, because that's the plan for Q1 of 2025. Overall, it's a lot. Read the report. We did a lot of work. I want to say it has been an immense honor to serve as the chair of this committee during Council Period 2025. I want to thank my fellow committee members and your staff for your partnership and engagement. I would also like to thank all the advocates and residents who testified before the committee, and the health agencies and executive staff who were collaborative partners in the work. Finally, I want to thank our staff and team Mike Schaefer, Heather Edelman, Ona Bacchus, Marcia Huff, Rebecca Cooper, Ashley Strange, Taylor Coleman, Gabrielle Rogoff, Sierra Wallace, Anna Barros Vasquez, and Nico Pacholkin, for their work ensuring that we, number one, were able to do as many hearings as we did, but also the quality of the bills that we worked on. I'll open the floor for any discussion on the Committee on Health Council Period 25 Activity Report. Councilmember Nadeau.
Madam Chair, I just want to thank you and your staff for all your hard work this year on what is a very tough and very important topic for the District of Columbia. I truly appreciate your leadership and all the time and effort your team has put into advancing so many key priorities.
Thank you so much, Councilmember Nadeau. Councilmember Parker.
Thank you. I think more than any other committee, I've attended more health committee hearings and meetings, in part because there have just been more, and there's been so much good work happening. That's what I meant by that. And when I think of like the concrete impact that Ward 5 residents have felt, whether it's the opioid abatement task force and group work on the ground, or health access, or data that has been shared from maternal health to STD coverage to Medicaid programming. I am really honored to work alongside you, and I'm really thankful for the work that this committee has been able to do over this council period. So thank you, and shout out to your team, because I know oftentimes it's thankless work, long hours, and it's clear a lot went into pulling all of this off. Thank you.
Thank you. Councilmember Allen.
I don't want to get
No
left,
pressure.
I don't want to get left out, so I appreciate it. Let me give my thanks and appreciation and kudos to you and your leadership to the committee, but also, of course, to your entire staff, who've done a phenomenal job of working throughout these last 2 years. And it is nice to kind of reflect back at the end of a 2-year period and kind of do these reports, because it does help remind us of the vast quantity of work that's taking place. When we go through a budget, we're talking about hundreds of millions of dollars, but we sometimes, in all the legislation and all the budget, can maybe forget, the very small stories that make big differences. And one of the initiatives you led through this last budget was around how are we trying to take a different approach to some of our opioid epidemic impacts at a community and neighborhood level. And I remember you had reached out to me and said, where can we put a focus in Ward 6? And I've been having conversations the last couple of weeks as that effort is now starting to get on the ground in Southwest, where we saw a lot of lives lost to opioid and fentanyl overdoses. And people are on the ground now, expanding their capacity, their ability to reach families, ability to reach those that are struggling with substance use, and really taking some smart strategic approaches. That wouldn't have happened without the actions of this committee and exercising what it can do in a budget. So just want to kind of highlight that for you and for your staff, of just knowing the impact of what sometimes we put on paper and we type up and we vote on and try to move forward, but it is making meaningful impact in communities and neighborhoods for lives. And so I appreciate that and look forward to continuing a partnership with you.
Thank you so much, Councilmember Allen. And I think on that was just an example in terms of all of us, you all willing to be partners and engage, and the trust that we have that your ward sometimes better than we do, and where the needs might really be. So with that, I move the draft Committee on Health Council Period 25 Activity Report with leave for staff to make technical changes. All in favor, please say aye.
Aye.
Great. Let the record reflect that the ayes have it. This concludes the last Committee on Health meeting of Council Period 25. We do have one last hearing. This Thursday, December 12th, we'll discuss the closure of United Medical Center and the opening of the new Cedar Hill Regional Medical Center in 2025. With no further business before this committee, the time is 2:27, and this meeting is adjourned. Thank you so much.